Hi guys, so hello. So I'm filming this at night. So this is our third discussion on diagnostic parasitology. So we're discussing, so this is the last part wherein we're going to discuss the different laboratory methods that you're going to expect in the section, in the parasitology section. Guys, this is not exhaustive. Ibig sabihin, this is not all the laboratory tests. I didn't include the blood test actually. So this is not exhaustive. However, I just want to give you an overview, and once we're going to go to the specific parasites, that's when I'm going to give more emphasis on some of the tests. Okay? So today we're going to talk about the different stains that we usually use, an overview on how we culture the um, parasites, usually mga protozoa, other recovery methods, a little bit. Actually, we discussed this already. Some of the recovery methods are your cellophane method for your Enterobis vermicularis. We have your serologic tests, yung mga immunoassays, a little bit of molecular tests, and animal inoculation, specifically Xenodiagnosis. Yan. So let's start. So guys, so just a little review lang. So class, laboratory diagnosis is very important. Yan. So what are its purpose? Number one, confirms a clinical impression that the condition has a parasitic nature. So guys, it rules out differential diagnosis. So usually when a person has stomach ache, and there's so many reasons why the person has stomach ache. Yeah. So the laboratory diagnosis that we do in clinical parasitology is very important because it will rule out parasitic infection if we didn't find any, yan, or it will confirm the suspected parasite. Yan. Next, aid a clinician in the choice of proper medication. So class, when the parasite is caused by an helminth, and we give them an anti-helminthic drug. Yan. And if the cause is a protozoa, then we're going to give them an anti-amoebic drug. Yan. So we don't give them antibiotic, okay? And what else? Help in monitoring the effect or treatment of regimen. So guys, unless in example, tapeworm, unless we saw as colex, yan, we still need to keep treating. Example, in malaria, yan, we still need to keep treating if the plasmodium is still there. So, mga ganon. Next class, reliable results. Ayan. So, I just want to emphasize this, that there's so many factors that affects our results. Yan. So, actually, the activity that we do to make sure that our results are within the expectation of our clients, specifically the patients and the doctors, we do a quality assurance program. Yan. So it's a whole new topic. And class, quality assurance is very important, that it consists of 10% of every subject in the board exam. In parasitology, it's 10% of parasitology. In microbiology, yan. 10% in clinical chemistry, 10% in all of the subjects class. Sobrang halaga ng quality assurance program. Why? Because it ensures that we will release reliable laboratory results. So, here's just a few. So, number one, so proper specimen collection and handling. So, in the pre-analytical phase pa lang, class, that we should be handling the collection properly. We should be actually preparing the patient properly, proper collection, the use of correct fixative, or the use of the proper processing for the specimen prior to examination. So should we fix it? Should we use a freshly passed feces, or a PVA fixed stool? What else? Proper specimen processing prior to examination. How much volume of stool do we need? Ganyan. Yung lalagyan ba, is it clean? Or ba contaminated pa rin ng Nutella, class? Ng cheese whiz? Yan lang. What else? Skill of the laboratory analyst, class. So it's very important that the medtechs are well trained. Yan. Continuous training. continuous professional development of our examiners, and what else? Quality of equipment used in the examination. So class, yun, you have to take care of your equipment, especially your microscope, yan. So because the right equipment will assist you, will facilitate a better procedure for you. Yan. So next class, so I just want to add this one. So in the concentration technique under flotation method, I just want to add Schiller's sugar flotation because this Schiller's is asked in the board exam. So class, it's very important in the recovery of coccidia. Coccidia. Ano bang mga coccidia? Cryptosporidium, Cyclospora, Isospora. So class, or coccidian oocysts. So yung mga ova class ng coccidia, we call it oocysts. Yan, oocysts. So usually these are also amoeba. Yan, they are unicellular. Guys, these are transmitted through fecal oral transmission. So class, one way to recover this coccidian oocyst class is to Schiller sugar flotation. So dapat pag narinig na yung Schiller sugar flotation, itong mga oocyst na ng coccidia ang maiisip nyo. So sugar flotation, so we boil a sugar solution with phenol. Yes. Preserve with phenol. So ito po yung mga coccidia natin. Yan. It looks more complicated than your typical cysts. So, ang tawag dito, oocysts. Yan, pag sa coccidia ha. Okay, so let's start with your staining method. So usually, we stain because we want to examine the different inclusions that are in your amoeba. So we want to know the nuclear characteristic, if they have chromatoidal bars, ano pa, if they have glycogen, inclusions. So usually, if it's for amoeba, yan. Usually, we don't stain class helminths because they are distorted in staining. Yan. So when we're discovering helminths, helminth eggs, ova, yan, catocats, wet preparation, wet mount preparation, concentration techniques, class, yan. Not so staining methods, amoeba usually. So class, for temporary staining, number 1, Lugol's or the Anthony's, yan. So we stain the glycogen. So glycogen ang sagot doon. Usually, yun hina-highlight ni iodine or the Anthony's. Next one, we have 1% isotonic eosin solution and 2% brilliant crescel blue, eosin and saline buffered methylene blue. Yan. So, class, dapat pag naisip nyo na yung eosin, what you're going to imagine is usually a red stain. When you now read blue, yung mga brilliant crescel blue, buffered methylene blue, these are basic stains. Yan. Or these are positive stains. Usually, these basic stains, itong mga blue na to, they usually stain your nuclear structures, your nucleus usually. So class, you will notice your WBC, yung mga neutrophil nyo, usually yung mga nucleus natin, class, pag nagsistain tayo, it's usually blue. And class, your cytoplasm, example, yung red blood cell nyo, it's actually stained as salmon pink. Yan. So usually, acidic stains or the red ones stain your cytoplasmic structures. Yan. Usually, yung mga proteins, yan. Ayun, mga RNA, yan. Pag DNA, usually blue. Yan. So, usually, mga nucleus natin, blue. So, kunyari, class buffered methylene blue, brilliant crescel blue, usually, ang mga inistingnan yung mga nuclear structures. Okay. So, class, then, so, yun yung mga temporary staining. So, temporary staining, class, you cannot keep them for a very long time. So, you just look at it for a while, yan, tapos, yan, you can throw it away, dispose it. However, in permanent staining class, you could store them, you could keep them, and there will be no changes. So, according to Zybeck, the sample of choice is PVA preserved specimen. So the fixative recommended for permanent staining class is PVA class na 10% formalin. However, class, in our quiz, isn't it that 10% formalin and PVA are complementary to each other. Therefore, your stool, if you want to fix it, you divide it into two parts. Yan. One part will be, you'll fix it with 10% formalin. One part, you'll fix it with PVA. Kasi yung 10% formalin, it's good for recovering helminths. Yan. PVA, it's good for recovering trophozoites, for preserving trophozoites, and permanent staining. Formalin, good for concentration techniques. Yan. They complement each other. Yan. So find someone who will complement you. So guys, so for permanent staining, it's good in especially the recovery of Dientamoeba fragilis. Yan. So it's usually recovered with permanent staining. So class, I just give you the three na gusto kong, ayoko kayong bigyan ng marami. Kasi wala kayong maalala. So kahit tatlo lang para malala nyo, okay? So we have weekly trichrome stain, iron hematoxylin, and acid fast staining. So weekly trichrome, it's the most common trichrome stain. So yun, its advantage is long shelf life, iron hematoxylin, excellent for morphology of intestinal protozoa. Hindi ko na ipapamemorize ko anong color ng background, ng ano. Wag na. And acid fast staining, coccidia na naman. Class coccidian oocyst. Okay, okay. So next class are your culture methods. Yan. So class, yes, we culture the larva. Yan, here. So I have two. Yan, kung kinukulture natin yung larva. Wait nga. Let's show first the life cycle of hookworm. So class, our next topic will be nematodes. Yan. So, hookworm class and Strongyloides stercoralis both has filariform larva and rhabditiform larva. Yan. Ang hookworm at Strongyloides class, ang mahirap i-distinguish sa kanila ay yung mga rhabditiform stage larva and filariform. Okay? Class, your rhabditiform stage are usually, since they are shorter, class, they are the younger larva. Sila yung nag-e-emerge from the ova. So once the ova hatch, the first stage will be the rhabditiform stage. And after a few weeks, yan, it will mature into a filariform stage. So notice, guys, that hookworm, and Strongyloides class, they have a bit of differences, right? They almost look alike. So class, our purpose here in Harada Morix filter paper strip culture is to culture this egg that it will turn into rhabditiform, and then it will develop into a filariform larva. So I'll show you the life cycle. Yan. So class, once our human will pass on feces, yan, and the feces will be on the ground, yan, or kunyari, some of the human collected the specimen, yan. So yung sa stool specimen natin, the diagnostic stage class is the ova. Yan. So usually ang nakikita natin class sa feces, once we focus it under the microscope, usually ova. Pero class, sa culture method, we want to see the larvae. Yan. We want to culture it up to the larva form. Gets ba? Yan. Galing nyo, class. So, we get the stool. We place it sa Harada Mori. We place it on a paper. Then eventually, we allow the eggs to develop and to mature and hatches into the rhabditiform larva. So class, if after a few days, we'll examine the stool, the Harada Mori strip, we will see a rhabditiform. And if we would wait a little bit longer, class, I don't know how many days, sorry. Yan, it could develop into a filariform larva. Yan. And the filariform larva in hookworm class penetrates the skin. Yan. It penetrates the skin. So class, the infective stage of hookworm is the filariform larva. Please, ha. Gusto ko alamin nyo na yan kasi next week, nematodes na tayo, okay? So, the diagnostic stage for hookworm is the ova. The infective stage is the filariform larva, the longer, yung mas mahaba. Yan. Hookworms, class, its entry in the body is skin penetration. Yan, skin penetration. So, yun, last. No, yung feeling nun, Makati kaya, I don't know. Yan. So, ganon. So, these are hookworm species. So, class your Harada Mori filter paper strip culture is good for identifying hookworms, Strongyloides, Stercoralis, and Trichostrongylos species. But, ngayon, hookworm and Strongyloides usually. Yan. So, class, we're culturing the ova to turn into a larva. The first one is to reveal the presence of the rhabditiform larva. If you want to distinguish between Strongyloides hookworm and Strongyloides or hookworm, yan. And what's the other use? Allow development of larvae into filariform stage. And so if you want to see a filariform, you do Harada Mori filter paper strip culture. Yan. So wherein you're going to get a filter paper, you're going to place feces on this, and eventually the larvae will migrate at the bottom of the graduated cylinder into the saline solution. Yan. So I don't know if you have to centrifuge it, but class yun, we will focus the sediment, yan, here. Focus it under the microscope, yan. So parang ano siya, Behrman technique, class, if you remember, for Strongyloides. So its principle is based on the active migration of the larvae. Yan. So yun, Harada Mori filter papers. So may filter paper dito. Sa Behrman, usually it's a funnel. May funnel. Yan. I hope naganda nyo. So we have also Koga agar plate technique. Yan. Yan. Yeah, you will place feces here. 7 grams of feces is cultured for 48 hours. Wait lang. So class, agar plate culture is considered to be the most efficient and sensitive method for the detection of Strongyloides stercoralis larvae. And this technique should be the test of choice, especially among immunocompromised patients. Wow, okay. So here we're going to get an agar media. So this is a special agar media. We're going to place 7 grams there, and for 48 hours, we will culture it under the dark at 26 to 33 degrees Celsius. Yan. Using a stereo microscope, yan, sorry, wrong spelling, stereo microscope, check for larvae tracks. Yan. So in B, yeah, you will have, so after 24 hours, check if there are larvae tracks. Yung ganon. Yung may bakas ng paggalaw, ng movement ng larvae. Yan, if based on what you see in the stereo microscope, it is positive, cover the agar with 5% formalin and allow to stand at 30 to 60 minutes. Then get the fluid, yan. So andun na rin yung malamang yung larvae, transfer the liquid with a pipette into a tube, centrifuge it for 2 minutes and discard the supernatant. Examine the sediment under a microscope. Yan. And then, there you're going to see the larva stage. Yan. So, if you want to see the larva, yan. So, you could do the Harada Mori, Behrman technique, Koga agar. Yan. So, usually hookworm and Strongyloides. Next class, egg counting procedure. Yan. So, naku, hindi gumalaw to. Yan. So, in egg counting procedure, usually what we only count are your ova. Ha? Ova from your helminths, not your cysts, not your trophozoites, not your oocyst. Okay? So, guys, we have 3. McMaster, Catocuts, and stall egg counting. So, McMaster, we already finished this. So, we use a counting chamber, yan, to quantitate the number of eggs per gram of your stool. Yan. Catocuts class, so remember, this is your cellophane, thick smear preparation. So wherein we soak the cellophane in glycerin, in malachite green stain, yan. Ano pa? With glycerin and distilled water. So catechins is good for quantitating the eggs in schistosoma infection. So catechins, its sensitivity is dependent on the consistency of your stool. Class, the consistency, the sensitivity of catechins, yan, the more formed the specimen is, yan, you could get more eggs. Yan, the sensitivity of catechins is dependent on the consistency of the stool. Yan, sorry. Next class, we have stall egg counting. So, bago to. Yan. So, your stall egg counting class, you get 4 grams of stool. Yan. And you get 56 cc or 56 ml of 0.9 sodium hydroxide, 0.9. 0.1 normal sodium hydroxide class. So if this is your Erlenmeyer plus 56 ml of your 0.1 normal sodium hydroxide, and add 4 grams of stool. 24-hour stool daw. Class, ano ba yan? Your sodium hydroxide is best, it serves as your diluent, and it saponifies fat. Yan. So, it free the eggs from the fat and the fecal debris. So, yun yung purpose ng, ng sodium hydroxide. It serves as a diluent. It saponifies the fat to release the eggs, and to release the eggs also from fecal debris. Yan. So, shake well. So, basically, mix well the stool and the sodium hydroxide. Yan. Then, class, get 0.15 ml. Yan. We have to be consistent with our measurement. 0.15 ml or 0.15 cc. That's what we're going to place in our slide with cover slip. Yan. So if you want to compute for the eggs per 1 gram, so eggs, the number of eggs in the slide times 100. And if you want to know how many eggs are there in a day, so eggs per 1 gram times the stool weight per gram that you use, so 4 grams, in 24 hours. So you have to measure kung ilan yung stool mo within the 24 hours. So grabe, yes, there is a collection of 24-hour stool. Yan, usually, if I'm not mistaken, usually they place it in a paint can container. Yan. So, yan. Okay. So now, we're done with the culture of your larval nematodes. Here we have your culture of protozoa. So class, I just want to introduce the different types of culture media that could be used. Ito, i-memorize nito. When we say xenic culture, yan. The culture refers to culture of parasite grown in association with other unknown microbial associates. Yan. For example, stool specimen cultured for E. histolytica. Microbial associates are known to provide various nutrients required to the growth of parasites. Yan. All microbial associates, however, are not beneficial. It is used for the primary growth of parasite. When we say xeniculture, it has other live microbial elements inside that culture. So, hindi siya pure. Yan. Unlike your axenic culture, so absence, axenic. So, xenic, yan, may microbial elements. Axenic, the absence of other microbial elements. So, it is a pure culture. So when we say polygenic, so marami, cultivation of parasite in associates with many known microorganisms. And monogenic, may isa siyang kapitbahay or kasama. If the parasites are grown with a single known bacterium, example, when we want to, so this culture for Acanthamoeba, it has a kapitbahay which is Escherichia coli. Yan. So, sabi niya, it can be used for primary growth as well as transitional phase in isolation. So, yun. So, Xenic means there is the presence of microbial associates, but we don't know how many. When we say polygenic, there's more. There's many microorganisms inside it. Monogenic, it has only one microbial associate. Axenic, it's a pure culture. Okay. So class, this is just an overview. Yan, hindi ko naman ipapamemorize. Just an overview. May idea lang kayo. So, Xenic ang Xenic ang Beck and Droblovs and Balamut. Usually, class, mga entamoeba histolita, mga protozoa naman to. Ito, Linstead, Trichomonas vaginalis. It's axenic. So, it's a pure culture. Yung Linstead, saka diamond. Yung Cleveland's monogenic. So, may isang microbial associate. Okay. And class, ito yung lumalabas sa board exam. NNN, Novi McNeil Nicole Medium. Yan. So, it's for the diagnosis of hemoflagellates. Yan. So, leishmania, trypanosoma, class, NNN. So, class, it's a slanted agar. Yan, slanted agar. Slant siya. Tapos, you place 1 drop of ground tissue. Sometimes they add penicillin if the site is a septic site. Ibig sabihin, there are bacterial contamination on that slide. So, it's good for diagnosing leishmania and trypanosoma, mga hemoflagellates, mga parasite na nasa blood tapos may flagella. They have a whip-like extension. So, serologic assays, class, so serologic assays right now are very popular and very important, especially in our fight against COVID-19. Isn't it, class, that we have 2 types of serologic tests? We have antibody testing and antigen testings. Yan. So, basahin nga natin to. Advantage of serological test and molecular test. So, class, isn't it that in molecular testing, we test for antigen? So, the proteins which are antigenic, yun, dinadiscover natin sa molecular test in our RT-PCR. So, nagpa-PCR rin tayo sa mga parasitic diseases natin. So, number 1, to detect antibodies against the parasite in question are used when biologic specimen do not permit microscopic diagnosis during chronic or asymptomatic infection. Sometimes, some infections do not exhibit symptoms, or sometimes it's so chronic already, yan, that perhaps the patient could not, we cannot get another biopsy. Yung may mga limitation, class, kasi hindi naman tayo pwede kuha ng specimen. May risk factors rin involved and sometimes we get specimen. Yan. So, we could use serologic test. Yan. So, example, sa COVID nga, diba, recently, that it is so invasive to use nasopharyngeal swab. So, what they want is the saliva na. Yan. Baka yung iba, siguro baka na-injure na damage na dahil sa kakaswab yung nila, yung mga sinuses nila, something like that. I don't know. Next, guys. Recommended in parasitic infections where direct identification of parasites in host are in deep tissues. Yan. So, class, some parasite, example, toxoplasmosis, toxocariosis. Class, they are deep within the tissues. And to get the biological specimen is so invasive. Example, CSF, class, ang mahal magkolekta ng CSF. Yan, ang mahal mag-aspirate ng kung ano ng mga aspirate, class. And class, serologic test is very affordable. So, CSF, papakuha ka ng CSF, baka mga 10K, bone marrow, aspirate, baka 10K rin ang pag-collect ng doktor. Yan. So, if the biologic specimen will put the patient at risk, then why not opt to use molecular test or serologic test? Yan. So, it's a good alternative for when some specimens are too invasive to get. Also, in cysticercosis and echinococcus. Yan. I think if I'm not mistaken, sa nervous system itong mga to. Yan. Next class, greatest utility of antibody tests is in investigating etiology. Yan, the sources of disease outbreaks. Yan, napaka-applicable sa COVID-19. And epidemiologic investigation. So class, you know, it's so example, we have UK strain of COVID-19. So we know that it came from the UK because most of the people who had that strain are from the UK. Meron na daw African strain, South African strain. So, yun. So, serologic tests, molecular tests are so important in mapping out the sources of or the etiology of infection. Galing, no? Yan. So, class, yan, just like I mentioned, we sometimes detect antigens, we detect antibody. Yan. So, antigen tests are usually more expensive because it's more sensitive and specific immunologic test. Sensitive in such a way that the first day that you show symptoms, you could already be positive for antigen detection assays. Yan, depending on the sensitivity of the test. But usually, the first day that you got your symptoms, you could already be positive for antigen detection assays. However, class, with antibody detection assays, that it could take time in the body takes time in producing this antibodies. So here, class, I cannot find a table for parasites. So let's have COVID. Yan, COVID infection. So example, but actually COVID and amoebiasis have the same incubation period. So class, the amoebiasis and COVID-19, their average incubation period are 14 days. Yan. So when we say incubation period is the time that the parasite or the virus entered the body up to the time that the symptoms exhibited, yan, or manifested, sorry. So, incubation period is a time that the virus entered the body or the parasite entered the body up to the time that the symptoms manifested. So, usually class IgM is produced, this antibody immunoglobulin M is produced after 3 to 5 days of infection. So, pag magpapatest ka ng antibody class, so first day pa lang ng symptoms mo, baka wala ka pang antibody. So, you have to wait. So, magpo-false negative ka. So, you have to wait mga 3 days, mga 1 week. So that, kasi dun lang magpipik yung production ng anti-IgM mo. But pag IgG naman ang tinetest, yan. So, though you don't have any symptoms na, so after the peak is about mga 28 days, positive ka pa rin sa IgG. So, IgG are usually late antibody responses. So, sometimes, even though you're already healed with that disease, may positive ka pa rin sa IgG. So, that's the disadvantage of antibody detection assay, especially if you're testing for IgG. You could be positive even though you had that infection for a very long time ago. So, yun, very prone sa false positive. So, even though you're not currently suffering with COVID-19, but you were previously infected, pwede ka mag-positive sa IgG. Yan. So, class, ayun, most siguro in preliminary detection, we prefer antigen detection. Yan. Antigen detection muna. So, may kanya-kanyang use. So, class, there's so many serologic assays in your module. Yan. And actually, this is in immunology. I think I discussed this for 2 weeks. Ganyan. So, hindi ko na i-discuss. It's just a brief overview of the different serologic assays. Here, Sabin-Feldman-Dye test. Yan. This is very important for toxoplasma infection. Yan. So, class, finally, we have animal inoculation method. Yes, we inoculate animals. Yan. Not animals specifically, but insects. Yung mga vectors na nagkakos ng disease. Yan. We inoculate or we infect them. Yan. So, the famous one is your Xenodiagnosis. So, up to now, this is utilized. in Chagas disease. Sensitive test for diagnosing Chagas disease. So Chagas disease, guys, is caused by your Trypanosoma cruzi. So Trypanosoma cruzi is a hemoflagellate. So ito siya. Yan, hemoflagellate. So may flagella siya. So guys, here in Xenodiagnosis, yan, so the scientists culture triatomine bug, redovid bug, or kissing bug. So pareho lang to. So ito, nagko-culture sila ng mga vector ng Trypanosoma cruzi, yung tahanan ng carrier, kumbaga, vector ng Trypanosoma cruzi class, kinukulture ng mga scientists in the laboratory. And what they do, class, dito sa mga lalagyan nito, sa mga canister na to, na tinali nila sa skin, sa braso, guys, in those containers, in those canisters, are redovid bugs or triatomine bug or kissing bug, class. So, or midnight assassin din ata pangalan nitong bug nito. So they will feed on suspected patients. So they have a clinical presumption that this patient has Chagas disease. And so they want to prove it. So what they did is they got triatomine bugs. So they placed about 4 bugs here in these canisters, and the bugs will feed on the human. Yan. So after that, they will keep the bugs, and after 20 to 25 days, the bugs are dissected and examined for T. cruzi epimastigote. So epimastigote is a morphological stage in the growth of Trypanosoma cruzi. So the characteristic of a epimastigote is C-shape. Yan. So cruzi, C-shape, Xenodiagnosis, Chagas disease. So parang mga tunog C. Yan. Ma'am, Xeno. Yan, basta tunog C nga. So cruzi, Chagas, puro C, Xeno, C-shape. Yan. So kissing bug chart. Okay. So ayun, class, they will open up the guts of this redovid bug. They will dissect it and focus it under the microscope. And if they will see an epimastigote after 25 days, then the patient is positive for Chagas disease. Ang galing, no? So class, we'll head nga to nematodes, and you will read that xenodiagnosis was also done in Trichinella spiralis. But I was reading it, and it was just performed in 1953. I cannot see an updated literature. So, baka obsolete na yun. So, hindi na ako naglagay class ng mga obsolete. Dito yung mga hindi ko na ma-search sa internet. Nevertheless, class, so that's a topic for today. Thank you for listening, guys. Bye-bye.